Good morning, Zimbabwe, and welcome to Zimbabwe Daily. This is your everyday platform where we bring you news and information as you need it and as is required. This is day 4 of the national lockdown level 4. Remember, we are under lockdown, but the nation had to go back into level 4 because of the rise in COVID 19 cases. And to help me unpack the state of our primary health care in light of COVID 19, I've invited the former Minister of Health and Child Welfare, Dr. Henry Madzorera. Dr. Madzorera, welcome to Zim Daily.
Thank you very much, Yvonne.
Awesome. How are you in the Midlands?
Yes, I'm in the Midlands. I'm in Pepe.
Right. Could you say kukwekwe?
Kuri right, kuri kunayawo zvakainzanirana zvakanaka. Hatisati yaita mafashama yet.
Okay.
So it's good so far.
Awesome. Vanhu vari kurima here akarima here ukwekwo?
Vari kurima, vari kumira-mira.
Okay, great. Thank you so much, Zimbabwe. We just want you guys to come on board. We want to have this conversation because I think what has made our society to be so disconcerted and disconnected from the whole COVID-19 issue is because of how it has been shoved into our community. So we've invited Dr. Madzorera so that he can unpack for us what is this COVID-19 and what is it that we need to do as citizens in order to keep ourselves protected, in order to keep our nation safe. Dr. Madzorera, can you give us a clinical explanation, a medical explanation of COVID-19?
So COVID-19 is a disease that started in 2019. That's why it's called COVID-19. And as you remember, it started in Wuhan, China. And it really spread like a wildfire throughout the world. It is a pandemic influenza of sorts. This is not the first time we've had such a devastating pandemic influenza. It's caused by a virus that is called SARS-CoV-2, severe acute respiratory infection virus, COVID-19, we call it now.
Mm-hmm.
It is a virus that affects mainly the respiratory system, and it clogs up your lungs, and it kills by making you become unable really to absorb oxygen into your system. So it's like you suffocate even while you're breathing. You're suffocating because oxygen is not getting into your lungs. It's not getting through, and that is it's a kind of flu, but it's a very severe kind of flu, and it's spreading very fast.
Right. And as Zimbabwe, I think when we went into the hard lockdown in March 2020, people were not expecting, COVID to actually hit us. And I think even up to now, the attitudes that we see in our societies is such that this thing is not real. Is it real, Dr. Madzorera? Is COVID-19 a real thing?
COVID-19 is very real. But what has happened is we have not had the kind of numbers that they had in China, in Europe, in America at the beginning of the outbreak, for reasons that we don't understand. Nobody really understands the epidemiology of this COVID-19. And people relaxed. In Zimbabwe, we relaxed, particularly, the people who run our healthcare delivery system and our government, they relaxed. They thought we were probably somehow, immune or somehow exempt from this condition. And everybody thought it was a problem that affects the cold countries, uh, and so forth. But no, this disease is here now, and it's really rapidly multiplying. We don't quite understand the factors that have caused it to start rapidly multiplying now, but we know that we are now getting into a very bad situation, and it will not be surprising if we don't take adequate measures. It will not be surprising if we get to a very bad state like we've seen in Europe, in America, in China before. So COVID-19 is really there, and we must really stop it in its tracks. It's possible to stop it if we work together and if our government really works seriously at stopping this COVID-19. It's not a joke, it's there.
Right. And you say something that caught my ear there. You said that government and healthcare workers were caught napping when this virus came into the world, as it were, in that we don't understand the epidemiology. I hope I understand how that goes. Now, I want to know, just a moment. Right. Sorry about that. I want to know, are we now doing something? As you're a medical practitioner yourself, are we now doing something about what is happening? Are we doing any sort of research as a country? Are we doing anything within our own selves to try and understand this variant of COVID-19 that is in our country?
Well, yes and no. We are doing something, but I don't think we are doing enough. Um, we yes, there is a new variant. You have mentioned the word variant there. There is a new variant of COVID-19 that has been reported in South Africa and in the UK, and it's said to be a more vicious variant of the virus in terms of how quickly it spreads, and perhaps in terms of also the severity of illness that it may cause. We don't quite know yet, but it spreads very fast. That's what we know. We well, our research capabilities in that area are still limited, and I wouldn't blame anybody for that. What I think we should be doing as a government, taking into consideration our technological limitations at the moment, because we can't really do the DNA sequencing of these viruses, and that doesn't matter. We should be looking at the epidemiology. We should have accurate figures. All public health practitioners in Zimbabwe should have access to the figures and the
Right.
true information and the raw data that is available, so that we can help government to analyze how this epidemic is going, and we can help the government come up with answers. Right now, the measures that we are taking are not really scientifically informed. As a public health community, we are all in the dark. We request information, that information is not there. We even doubt some of the figures that we get from the government. We do
Right.
not think we are getting a true reflection of what is happening in Zimbabwe. We need to be analyzing this data. As a public health community, government should accept the help of every public health physician, every doctor in the country, and we'll come up with some answers.
Right. You say something that is also quite intriguing. Why is it that you, as medical practitioners, are not able to get the information, this raw data that you are talking about? Why is this information tightly kept?
Well, we don't know why the government wants to keep that information private, because it's really public information.
Yeah.
And we is there something they are hiding? Are they hiding some deficiencies in their data collection? Are they hiding some inconsistencies or lack of correctness, lack of accuracy in the data, I don't know. But all we know is that you can't walk into the Ministry of Health and say, please, can you give us your weekly raw data, daily raw data, so that we can help you analyze this. You will not get it.
Right.
Requests have been made before.
You know, it's actually disturbing because I think we should all be working together in order for us to actually deal with this pandemic. But if this information is tightly kept like that, then how is the public supposed to react? How should the general citizens respond to this kind of a situation?
Well, it's like we are an imprisoned population that can't get information. The public then responds by not trusting what the government gives us, because
Right.
there is no transparency, there is no openness in the data that we are getting. And we also know that there is not enough testing that is happening. Uh, that makes us wonder if, the mortalities that we are hearing, the people who are dying, the figures are actually accurate, or there is more that is happening than we are getting from the public domain. It makes us wonder because we do not have accurate information.
Right. Thank you so much. I was just looking at some comments coming through. Thank you, Sanim Bofana. You mentioned that you were not quite getting us, but you said it's sorted now. Thank you so much for coming through. Noni, you say tell that incompetent leader to respect Zimbabweans and step down. Thank you so much for your comment. I'm sure you are referring to government. I'm not too sure, but all the same, thank you so much for your comment. Kudzikupe, you say, please, can you tell the police officers to stop abusing people? How can you stay at the whole day? At home the whole day when your kids are starving? Please, what the police are doing to people, especially women, is pathetic. We're going to try and get our police spokesperson to come through onto the show so that we get to appreciate what they are doing and what they are saying. We've seen a lot of statements coming through from the police talking about the behavior of some errant officers. Today, we are talking to Dr. Henry Madzorera. He's the former Minister of Health and Child Welfare, and we are talking about the COVID-19, the state of our primary health care in light of COVID-19. We've covered a number of issues. You talked about government not releasing accurate and true information to those in the medical fraternity so that they can help government to analyze the data. So because government is keeping it tight lipped on the issue and on the data, not much investigations have been done also by those who are in the medical fraternity. Now, you mentioned something, Dr. Madzorera, that I would want to come back to, and that is the issue of research, and that you can't really do, is it DNA sampling or something that you mentioned? What you can only work on now is analyzing the data. Why are we not able to do research, the microbes or whatever you call them, whatever language you use? Why is it impossible? Why is it difficult, rather, for us to do that research? Why don't we have the equipment?
I think it's just a state of the economy. We do have the scientists in Zimbabwe who can do that, but we do need equipment. So it's really a state of the economy. Zimbabwe has been going down for a very long time. We used to be at the top of the ladder, in our region in terms of research and so forth. But we have really sunk very low now. And there are many samples that we have to send to South Africa for certain tests and investigation. Routine, I'm talking about routine clinical tests now. I'm not talking about even DNA analysis, just routine clinical tests. You find we are sending to South Africa just to get some certain routine clinical tests done. And that is not good. we used to do everything on our own, and we used to move in tandem with international standards as far
Right.
as the science of medicine is concerned. So let's fix our economy and let's give priority to healthcare. The problem is there is no priority to healthcare. There is no
Right.
priority to research in Zimbabwe.
This is really sad. Anyway, we would stay there. We hope that the people that needs to hear this information are actually listening in, so that we are able to make a movement. Now, I want to come to the state of our health workers. I think we saw yesterday there were demonstrations at the Mbuya Dorcas or hospital, maternity hospital. The nurses there were demonstrating and demanding for PPEs. What is the problem with getting PPEs for our medical, our healthcare workers? What is the challenge that we have, seeing that we've heard the United States saying they've released about 93 or $13 million towards COVID-19?
The problem is corruption, pure and simple. We
Right.
have seen monies earmarked for COVID-19 response disappearing. We have seen contracts being awarded irregularly. We have seen people being arrested and released. We have seen cases that are very obvious. We know who is stealing the money, but there's been no investigation. There's been a serious reluctance on the part of the police and the government to prosecute um, and to recover monies that have been stolen. So yes, the nurses are saying we need protective equipment. The truth is, doctors and nurses and other health workers are catching COVID-19 at an unprecedented rate. I heard about a certain maternity hospital here in the Midlands where everybody working that maternity wing got COVID-19 because they are just working without any protection. And we are coming to a situation where half or three quarters of the health workers will be COVID-19 positive and at home. Who is going to run our hospitals? And
Right.
some of those people are going to die, a certain percentage dies, we know that. And that will be a great and terrible loss for Zimbabwe as well. So the nurses are correct, the doctors are correct in terms of demanding proper PPE. It is the government's duty and responsibility. The money is there. The government must prioritize PPE for health workers. We have got the health levy. We've got other levies that the government is collecting, the transaction levies from the banks and so forth. That money in this epidemic, in this crisis, should all be channeled towards taking care of our healthcare delivery system instead of using it for luxuries and for looting.
Right. I also want to find out, how can government increase or improve its testing capacity? How can we improve? You mentioned the issue that we're not testing enough, but how can the government increase its testing capacity at this moment?
Our problem right from the start was that we were relying on donors to give us testing kits. You remember the Jack Ma kits that came. Remember, some stuff that
Yes.
came from WHO. We cannot rely on donors for something this important. Now, I like this statement. Yeah, I always tell people it doesn't matter how poor I am, but if I find you buying underwear for my wife because I'm poor, there will be a very big fight. That is my job. Even if I'm poor, I'll make money. I'll find money to buy underwear for my wife.
Right.
When we subcontract things like the COVID response, buying of PPE for our health workers, um, eh, and we allow other nations, other countries, other organizations to do it for us, and we sit back and relax. It's like allowing the man next door to buy underwear for your wife. These are important things for which
Right.
we must sacrifice, and we must make sure as a government we take every penny that we can take to protect that area. It's sacrosanct. It's important. It's holy. and we must guard it safely. It's holy space. We cannot
Right.
allow everybody to come and try to take care of that for us. So this has been our problem. And now some donors made some money available and it was looted. And we do not have adequate PPE. We have never had adequate PPE in our hospitals. You have never
Right.
walked into a hospital and seen someone wearing those suits that.
All right, so we seem to be having a little bit of technical challenge there with the doctor. He's coming to us from Kwe. I hope we'll have him back very soon. So Right. So we hope that we'll have him so that we ask this question that Sanimbo Fanu, you've asked, kindly asked the doctor to say something about this new COVID-19 vaccine. We see a bit of demonstrations in countries like UK with people saying the vaccine is not good enough. So we need to find out a little bit more on the issue of the vaccine. So I'll just try to get the doctor online via phone so that we can have a continuation of this discussion. All the same, we have also seen countries making a down payment on some of these vaccines, and nothing has been said about what Zimbabwe is doing. So we need to also find out what needs to be done in order for us to to get down with the issue of COVID 19. It's a really serious threat. It's a medical issue that we need to deal with. Unfortunately, as a nation, we've communicated as a security issue, and there's people wear their masks only when they're approaching police and they're afraid. People are wearing their they only sanitize their hands when they're getting into shops, those that are open at the moment. And we are in lockdown level 4. And that essentially means if you are part of the essential services, you have to have a letter and you need to have adequate information on you for you to get into town. So we keep trying the good doctor so that we can have him on as we conclude this conversation, because we were just about to wrap it up with the questions that you are sending. So let me try once again to get hold of him, and then we should continue with this conversation. Please come through with your questions, your comments, any information that you may have that relates to this issue. How has COVID-19 been communicated to you, and how do you feel about it? That's what we need to know, so that we are able to come up with answers and to bring COVID-19 cases lower than where we are. My name is Yvonne Muchaka. This is Zimbabwe Daily. And today we are talking about the state of our primary health care. All right, Dr. Madzorera is back. Thank you so much, Doctor. We wanted to get into the question that Sanim Bofana asked, and he's saying, can you say something about this new COVID-19 vaccine? We see a bit of demonstrations in countries like UK with people saying the vaccine is not good enough, but we've also seen countries like South Africa and other nations making a down payment for the vaccine. How far are we as a nation in terms of this new COVID-19 vaccine?
Well, in general, vaccines are good. We've used vaccines in Zimbabwe for a long time. We used vaccines to eradicate smallpox, and we are using vaccines to eradicate polio. We are nearly there. And so vaccines in general are good. But I must say people are generally skeptical about the new vaccine, the COVID-19 vaccine that is coming up. People
Why
have
is that?
concerns.
Yeah.
People have concerns. There are lots of conspiracy theories, and I cannot answer to this because I don't have any proof. I don't have any scientific proof that there is anybody with any malicious intent, you know, to harm the world or to control the world using these vaccines. All I know is that in general, vaccines are good. And if the pharmaceutical companies manufacturing the vaccines are being honest and true and making good vaccines, a vaccine will be a good thing to have. That's how we've controlled these viral illnesses in the past, and I think that's the way forward. So it is all right. People have started vaccinating in the UK and in the US and in other countries that have money. It will take a while for the vaccine to get here because you know, the rate of manufacturing is also limited by the plants that are manufacturing the vaccine. So, but we will get a vaccine one day. The only problem I know in Zimbabwe is we're going to wait for donors to buy the vaccine for us. And
Right.
that means it will take a very long time before we get any vaccine into Zimbabwe. Yes, you mentioned South Africa, they've made a down payment. They've got a stable economy. They've been doing well. They've been managing their natural resources well, and so forth. So, but I do hope the government of Zimbabwe will also start making moves towards
Right.
procuring vaccines.
All right, and as we come down to conclude this conversation, what can Zimbabweans do in order for them to protect themselves from this second wave of COVID that is seemingly very, very aggressive? What should we do?
First of all, let's demystify the whole issue about masks and the measures that we are taking. We don't wear masks because the police are looking at us and they are roaming around looking for people to beat up and to fine because they are not wearing masks. It's extremely unfortunate that the narrative that government has given is giving people the impression that masks are just a legal requirement and they don't help in the control of COVID-19.
Right.
Masks are very useful. When you wear a mask, you're protecting yourself, but more importantly, you're protecting the next person. And if I wear a mask, really I'm protecting you. If you wear a mask, you are protecting me, you are respecting my life. That is how it works. The one who is wearing the mask really preventing himself from spreading the infection that they have in their mouth and nose. So let's wear masks, let's respect each other, and let's wear masks properly. And let's make sure that when we wear masks, we cover the entire nose and mouth. And that's the first thing. Masks are important. Let's wear them in all public places. We encourage the police not to harass people. Educate the people. Let the government show us why masks are important rather than fining people and beating them up. Social distancing extremely important. Let's not go to gathering. Let's stop this thing of gathering at funerals and at weddings. You know, these are hard times. These are different times. Let's respond to the time we are living in. So many people are catching COVID-19 at funerals. In the shops, let's not congregate and fill the whole shop. Let's not have musical shows. We've church, we have stopped church. But we saw even top government officials attending a very crowded church service in Bulawayo, at Christmas time.
Right.
That was not a good thing because people do what they see. They don't do what we tell them. So when they see us congregating and addressing large gatherings of thousands of people, they will say, the big bosses are doing it. Why shouldn't we do it also? So they will do it, and that will be much to their risk. The mortalities have really risen. We saw 34 people dying in one day a few days ago, and that's scary, and it's real. Now, nearly everybody knows someone who has died of COVID-19. That was a rare thing a few months ago.
Right.
So let's take it seriously. Shaking hands is not good. Hugging is not good. Let's avoid it. We must wash our hands. If there's anything that COVID-19 has taught us, is good personal hygiene. Let's wash our hands regularly, constantly, with soap and water. If you don't have soap and water, you can use sanitizers. There are some people who think without sanitizers you can't survive. No, sanitizers are an alternative to soap and water. Use whatever it is that you have available with you. And if we do that, I think we'll be able to. Now, the issue of isolation, what shall I call it? Lockdown. The issue of
Right.
lockdown is extremely important. Let's stay at home. Let's not travel unnecessarily. Let's stay in our homes. Let those who have to go out, like health workers, go out and do their job. But the rest of us, let's stay at home.
Right. Right. I just I just want to ask this. I know that you also have your own practice. Um, hmm, what can I say? I don't want to contradict government because I think there's been a lot of contradictory statements coming from government. We had the acting spokesperson, is it the minister, the acting minister um, of information and publicity saying that our hospitals are overwhelmed. We also saw the government spokesperson, Mr. Nick Mongwana, saying that the government is in control. What is the state of our hospitals and our clinics at the moment? We saw a lot of people putting out SOS. If you know a hospital that's taking in COVID patients, please advise. If you know somewhere where they have got ventilators, please advise. So, in terms of our general outlook, how is it? How are our medical facilities?
There are two things. The hospitals that are there are full to capacity. There is no capacity to admit more patients in our hospitals, particularly in Harare. I know my Harare colleagues are always asking, is there any hospital where I can admit a patient? Patients are running from one hospital to another looking for a bed to have their relative admitted. Some people are dying in their cars while they are still running around 3 or 4 hours looking for a hospital where they can be admitted. That is the reality. There are no hospital beds. Government has not taken measures to increase capacity. Secondly, there are many cities like Kwekwe where there is not a single COVID-19 admission center. Two centers were renovated in Kwekwe. I remember at Kwekwe General Hospital and what we used to call Redcliffe Medical Center. They were renovated and made ready for COVID-19, but they were never opened. I know for one of them, one of the senior, in fact, the most senior government official in the province said, I want to come and personally open that center. It still hasn't been opened. Why waste time when they finished, when the municipality of Redcliffe finished renovating that center? It should have been opened. Why do you want to come and open it? You
Right.
know, so that is the problem. There are many places where, so if you have your COVID-19 in Kwekwe, we'll treat you at home. That's what we are doing. If you get worse and you really require admission and intensive care facilities, we have to ship you off to Harare, and where you will probably not get a bed very readily, but we'll still ship you there anyway because we can't do anything with you here. And that's the problem. That's why people are dying unnecessarily. Some people who could live if they got proper health care.
But why open something in a pandemic? Isn't we saying people can stay home? Really?
I don't know. There are some people who have cameras. They have, fanfare, but we are in a very serious epidemic, and we should cut out the red tape.
All right, Dr. Madzorera, thank you so much for making time to have this conversation with us. Sani Mbofana is thankful. He says, thank you, doctor, for that clarification, and it's good to see you again. And Msarowa, doctor. Toda kukuonai.
Thank you very much, Yvonne, for bringing me onto this show.
Awesome. Have a wonderful day and do keep safe.
Thank you.
Awesome. Thank you so much, Zimbabwe, for joining us on Zimbabwe Daily as we bring you a lockdown level for day 4. We're just looking at issues that are pertinent so that as a nation we move together in one direction. So if we've got any issue that we feel we need to address on the platform, please do feel free to write to us on our Facebook page. If you go on our website www.zimdaily.com, there is a little widget there for WhatsApp. So you can reach us on WhatsApp, or if you want to send to me directly, you can do so on 0774 107 682. Let us keep the conversation going. Let us mask up. And Janzi, let us put on our masks correctly, covering our nose, covering our mouth. You are protecting yourself, you are protecting the next person. Have a wonderful day, and God bless you, Zimbabwe. Let us fight COVID-19 together.